So I'm Barry Dorn, and I'm an orthopedic surgeon by training. I've been working in healthcare for about the past 20 years, working on conflict and leadership. I met Lenny about 20 years ago, and we started to work together at that time.
My name's Lenny Marcus. I'm a PhD, Barry's an MD. We've been working together for 20 years, and it's been a combination of looking at the practice issues and practice problems that physicians and others in healthcare are facing right now, along with looking at the academic work that's being done on negotiation and conflict resolution and leadership that's really been at the center of our work together. Meta leadership is a practice set that helps people who are in leadership positions to identify what are the core pieces that they need to be paying attention to. And it starts out with who you are. It's the person of the meta leader. It's your emotional intelligence. And one of the things we say, if you don't know who you are, you're not going to be able to help other people understand who they are. Our definition for leadership is people follow you. The second is understanding the situation in which you're leading. And most importantly, recognizing that many different people will look at the same situation and come to different conclusions. And finally, it's building connectivity of effort, being able to pull people together, unity of mission, singularity of purpose, leading down to your subordinates, up to your boss, and across to all the different departments and organizations that are part of the enterprise that Barry referred to.
Meta leadership is becoming more and more important every day, primarily because of the rapid change that's happening in healthcare. Physicians today, we don't learn leadership in medical school. It's not a course. No one ever teaches us leadership. You learn it from books, you learn it from observing people, but you never really are taught what to do in difficult situations. We thought it was really necessary for ACPE to put together a leadership module, train physicians specifically in leadership, look at the areas they needed to be an effective leader, and put them in module after module, which were interrelated. For many years, in the very beginning of ACPE, many of the courses were not related. Now we want to put this all together to make it a sort of a whole curriculum, so when a physician finishes it, they're really well equipped to go forth in the marketplace.
And an important thing that what Barry says is that it's not only that you have to do it, it's really the how to do it. And so many physicians find themselves in important leadership positions within their organization, or they've moved up through their department, and along that route, though they've been promoted, nobody really stopped to say, well, how do you lead? What are some of the practice skills that you need to have on board? And as Barry said, this question of being able to integrate, bring together a lot of different people, that is in many ways at the heart of what meta leadership is all about. And as the system is looking for ways to integrate, to improve the efficiencies, the population of the health, physicians who are able to bring that integration to their system have a real value added for themselves and for the people they're working with.
The advantages are it gives a student or a physician an opportunity to learn in a graded fashion those important skills which are necessary to be a leader. And it also allows the curriculum to be interrelated. In other words, you could take a whole bunch of different courses and you could say, well, now how do I connect them? So I think what ACPE has done is said, okay, let's take those courses, let's connect them. We've had a number of joint faculty meetings where we've talked about what we hope to accomplish, what the certificate would give our physician leaders, and how we could make them better at that particular job. So I think the whole concept of the Meta Leadership Certificate is to make physicians understand that there is a body of knowledge that you can learn, and if you learn that body of knowledge, you can apply it, and you can be much more successful.
You know, one of the things that we found among students of ours who've learned meta leadership, and this goes back to what Barry said, they're intentional. And people will tell us after they've been through a rough period, the question that goes through their mind is, how would a meta leader handle this scenario? And it requires them to have that emotional intelligence, because many times things are rough. It requires them to have a real good situational awareness, and then being able to take all the skills that come through the certificate and apply them to that problem. I mean, leaders fundamentally are problem solvers. If everything was going wonderfully, anybody could manage that situation. But when you're going through any kind of a change or conflict or a crisis, that's when meta leadership really makes a difference. And we're hoping that that's what people will gain through the certificate program.